Welcome to the Promoting Healthy Workplaces, a focus on the psychosocial work environment webinar. This is the 13th webinar in our Return to Work, Stay at Work series, and we're glad you're here today. My name is Tanya Hyde, and I'll be moderating the webinar today. I'm the project manager with the Canadian Institute for the Relief of Pain and Disability, and this webinar has been made possible through the support of the Direct Access Program through the BC government. As I mentioned, my name is Tanya, and I'll be moderating the session today and handling the Q&A. Our presenter today is Dr. Stavroula Leka. Dr. Leka is an Associate Professor in Occupational Health Psychology at the University of Nottingham and Director of the Center for Organizational Health and Development, WHO Collaborating Center in Occupational Health. Dr. Leka is a chartered psychologist, chair of the International Commission on Occupational Health Scientific Committee, Work Organization and Psychosocial Factors, and a fellow of the Royal Society for Public Health and the British Psychological Society. Her expertise lies in the translation of occupational health and safety knowledge and policy into effective practice with a focus on the management of psychosocial risks and work-related stress and the promotion of mental health in the workplace. And I will hand it over to you, Dr. Leka.
Thank you very much, Tonya, and thanks to everyone who is attending this webinar. It was a quite nice introduction. I don't want to say more about me. As you have understood from the slide you're seeing, I will be doing a presentation that taps onto the work that quite a few stakeholders have been involved with. So we'll do a background presentation on the psychosocial work environment. So what do we mean when we talk about psychosocial risks? But also I will be talking about best practice in this area and presenting to you some recent frameworks, both policy frameworks and practice frameworks that can be used in organizations and also to promote these issues at the national level. And as you can see from the slide, many organizations have been involved in this program, but you'll be hearing from such as the World Health Organization, the International Labour Office, and different country offices. Well, just as a bit of an introduction, obviously all of us know that the situation in the workplace is very complex. We have different types of risks that are affecting businesses, and obviously they have an impact not only on their operations, but also on their reputations, and that is very important in today's society, and as a result on their viability. However, in a study conducted with directors of companies, we can see that only 11% of 1,000 directors responded to that they have a complete understanding of the risks that their organizations face. And more worryingly, actually, 23% stated that they have limited or no understanding at all. So that basically tells us something, because if we are working to promote a healthy workplace, which is what I will be talking about today, we need to be able to talk in the language of business, in the language that any stakeholder actually will be able to understand and relate to if we want to achieve any progress. And regrettably, I don't think that this is happening or happening effectively now. The third point, because as you can see, consultants do their own surveys as well, Ernst & Young tell us that risk priorities still revolve around compliance and financial issues. So law and finance are the two major things that affect organizations, or at least the minds of the directors, and that is not a surprise at all. However, there have been a number of stories that have received a lot of publicity around the world. For example, we have scandals involving major banks that affected national economies. Even as a result, if you like, we can see that the European economy is in a lot of trouble, and the US economy has been in a lot of trouble in the recent past. So there is another sort of perspective that has started to evolve around both ethics and people. So more and more we see that business is concerned with morality and ethics, and increasingly these issues are related to employment and labor issues, and also to psychological and social concerns, and how these affect both the behavior of the individual and also the operation and the productivity of the organization. So in the business literature, what we see nowadays is a lot of talk about people and what the term people risks. I'm not sure whether the term people risk, the way it's presented in the business literature, is the same as the one I will be presenting to you here today. From my interactions with colleagues in different business schools, it seems that people risk for them is the risk that comes out of the behavior of individuals. But quite often what they tend to do is to ignore the context within which individuals, or employees in this case, operates, and the pressures that they're under, and the pressures that the organization by which they're employed they're under. So what we see developing is this concept of new risks, but also emerging risks. And one of the most important types of risk in today's work environment is termed psychosocial risks, or risks that are related to the design, management, and organization of work. And hand in hand with these types of issues that I'll show you in a moment, we have problems such as work-related stress, such as violence, bullying, and harassment in the workplace, that of course have been shown to have a significant impact not only on individuals, but also on enterprises and on society overall. I will show you some of the latest studies in Europe, for example, as an example. Let's see at the definition of psychosocial risks. This is one of the most comprehensive ones, and when we see definitions about these types of issues that are usually are seen to be sensitive issues in workplaces, we can understand more or less where they're coming from, depending on how comprehensive they are. This one here comes from experts, and it's a bit long. If you see at other definitions coming, for example, from trade unions or employers associations, if you find them from employers associations, that is, then you see that they tend to be shorter, much shorter. In any case, this one tells us that psychosocial risks concern the interactions among job content, work organization and management, and other environmental and organizational conditions on the one hand, and the employee's competencies and needs on the other hand, that prove to have a hazardous effect, or a negative effect, if you like, on employees' health and safety through the employee perception and experience. So we have an interplay between the work environment conditions and the employees as individuals, and that, through the subjective experience of the employee, can result potentially in negative outcomes. Here I'd like to pause for a minute and talk about the concept of risk, because in this definition and in many others in the field of health and safety broadly, what we see is that the risk very much is related to negative outcomes. However, that is not the case in every field, and of course organizations deal with risk on an everyday basis, individuals deal with risk on an everyday basis, and in fact if we look even at standards on risk, for example there's an ISO standard on risk management, there we see that risk is defined simply as an effect of uncertainty on objectives. So here we do not see a positive or a negative connotation. However, in health and safety, traditionally we see it in a negative manner. Could that perhaps have a perception or have an effect on the perception of stakeholders in relation to these issues? We see often that managers very much like positive concepts, such as work engagement, productivity, or motivation. Could that have an impact on the perception and also on the prioritization of these issues in the workplace? So risk management, according to the ISO, is what will determine whether the outcome of risk, the outcome of that uncertainty, will be negative or will be positive. It depends on the process of risk management and how well the organization implements risk management, whether the outcome will be beneficial for the organization and its employees or not. And in fact, this is a long table, and I'm sorry for the small letters, but as Tonya said, the presentation will be available later and you can study it. In the literature, we see that the psychosocial work environment has a number of dimensions, recognized dimensions. You can see them on the left. You can have dimensions that have to do with job content, for example, the variety we have in our work, or how much we use our skills, or workload and work pace, things like schedules, working hours, for example, the control that we have in our workplace, environment and equipment, and the list goes on. I'll show it to you in a moment. But if we consider all these dimensions on the left, yeah, they do not necessarily, if we see them, if you see this list, we will not necessarily think that, okay, that is a negative list. It depends on how the risk is managed, whether it will be on the downside, and you can see it in the middle, or on the upside. So how well we manage the dimension on the left can lead to either negative or positive outcomes. And I don't think that in the literature researchers and academics have focused a lot on the opportunities or the upside of risk in organizations. In health and safety in general, we focus on the downside of risk in this area. This table goes on, so we have also references, of course, to issues such as organizational culture, and communication is very important here, or interpersonal relationships at work, and here you see also the reference to issues such as harassment and violence. The role the employees have in the organization, the responsibilities, of course, the traditional issues that relate to career development, and finally, the home-work interface. So this is a long list and a complex list, and many times employers fear that if they start tackling these issues, it will be a never-ending process, and they cannot see how they can achieve good outcomes at the end of it. So the question is, how much do they do, if they do anything at all in different countries, and what is the effect of what they're doing, and have we adopted good enough approaches, processes, and systems to deal with these types of concerns in a modern work environment. Of course, most of the studies that have been conducted in this area concern the relationship between psychosocial risk on one hand and the experience of work-related stress on the other. And of course, we know that work-related stress is a very important concern in the modern work environment. And here again, you can see from the definition that it refers to a pattern of different types of reactions, whether they are emotional, cognitive, behavioral, but physiological as well, to different adverse aspects of work, content, work organization, and the work environment in general. And here I'd like to differentiate between the concept of work-related stress and the concept of pressure in the workplace. And I think that is very important because often you will find that many employers, in particular, will think that, well, I'm not sure about that because I think that a bit of stress is good for me. When I'm under pressure, when I have deadlines, this is when I'm most productive. And here it's a little bit the fault of academics too, because if you see that the old literature that was coming out in the 60s especially, you found this reference to bad stress or distress and good stress or eustress. And now you see that this initial differentiation has been clarified. So all guidance, good practice guidance that exists, with no exception across the world, makes this distinction between work-related stress and pressure. Pressure in the workplace and different levels of pressure in the workplace can result in different reactions according to the individual, its needs, and its abilities in relation to the task that they have to conduct in the workplace. For some people it can be motivating, for others it can be too much. However, when that pressure is prolonged, it's chronic, and it is unmanageable, then unmistakably it leads to what we call in term work-related stress. And work-related stress in all guidance, as I said, is now conceived and perceived as a negative outcome of exposure to psychosocial risks and also to a bad physical work environment. We should not forget that these interact in reality, obviously, in the workplace. I have some statistics here, so there are many more. For example, in the European Union, where we have a lot of good data, we consider workplace stress affect more than 40 million individuals. In the US, another example, 69% of employees report that work is a significant source of stress. Also, there is a very high cost. For example, in the old member states of the European Union, we see a cost of between 3 and 4% of the national gross domestic product. So, we've had a lot of recent reports from countries that show that that has been going up. The interesting thing is that there is now evidence that has started to accumulate also in developing countries or the newly industrializing countries. So we see that a lot of the problems that were thought to be the problems of the developed world now are being found in the developing world. And of course that has been happening with globalization and with the export of different work organization processes to developing countries. And the WHO, if you're interested, has conducted a lot of interesting work in this area that I can direct you to. This is one of these outputs from the WHO, and it's called The Health Impact of Psychosocial Hazards at Work, an overview. So if you're wondering, how can all these issues that I've talked about have an impact on individuals' health and well-being, this report summarizes it very, very nicely and very concisely and makes a very persuasive argument. So even if you Google this, you can find it. It's freely available on the World Health Organization website. Okay. Now, I want to show you some very interesting recent studies that have come out. Of course, we see that all the political discussions in relation to the issue of work-related stress and psychosocial risks, we find that a lot that is related to unemployment. And of course, unemployment is a big issue in today's world, also as a result of the recent economic crisis across the world. And of course, unemployment has been established as a risk factor for elevated morbidity and mortality, also in relation to addiction and a number of stress-related disorders, especially cardiovascular disease and depression. So the evidence is very, very strong now that different types of psychosocial risks are in particular related to cardiovascular disease and depression, but also to other mental health outcomes. However, look at the bottom. This is an interesting study in 2011 that showed that actually those employees who are exposed to work environments that are very, very poor in terms of psychosocial aspects, so a very poor psychosocial work environment, experience worse mental health than the unemployed. And these studies have not been publicized enough, and I think, of course, they're very recent, but I think they show a very, very strong message, and they should. Let me show you another one, because that shows it very nicely. This is a study from 2010. Here they looked in particular at fatigue and depression. And if you look at the top, actually they looked at different types of problems, including diabetes and cardiovascular disease, including depression, fatigue, including mental and physical fatigue. So at the top you can see these are going up, and this is before the retirement event. And actually at the bottom you can see a drop, a significant drop in the experience of depression and fatigue associated with the retirement event. And again, that concerns those who are exposed to the worst psychosocial work environment. Those people actually experience much better mental health when they retire. Another quite convincing study looked at macro indicators in different countries. So one of the key indicators in countries is lifelong learning. As we know, the world population is aging, and in different countries of the world, the retirement age is being raised. So in order for us to remain in employment longer, we have to be healthier, but also we have to update our skills. So here, they looked at the main aspects that are related to work-related stress. For example, how much control we have at work, or whether we receive adequate rewards at work. And they track different countries in terms of lifelong learning. And what you see here is those countries that are clustered on the left-hand side yeah, at the top, are those in particular where we find very low work control for their employees. And you can see that, yes, at the same time, they engage at very little lifelong learning. And the same situation actually is mirrored for those that are experiencing very low rewards or inappropriate rewards in relation to their efforts at work. So the findings for both of these dimensions are quite consistent. And they're quite worried, because if, as I said, we want to keep people in employment, what we should be doing is raising awareness that good work is good for everyone, not necessarily any type of work. So to just devise public policies like raising the retirement age to keep people longer in employment will not work unless the work environment is healthier and is conducive to longer and healthier working lives. So here we see that there is a strong case for the link between managing psychosocial risks and the psychosocial work environment effectively and sustainability of both businesses and society. Now, what has been done? Let's look at that. What has been done, first of all, at the national level? Well, we have a lot of countries that have tried to introduce frameworks. Of course, Canada is one of them, and I'll talk about that in a moment. Let's start with Europe as an example, because in Europe often we are hailed as the ones that have the best policies. But as I'll show you in a minute, there's a question about how this works in practice. So in Europe we have what is called a framework directive, that is the top there, the top policy that I'm showing here, that basically obliges employers to deal with and effectively manage any type of risk to workers' health, safety and well-being. So this is written in law. And there is reference to issues such as work organization as well. That was the legal piece, but also, as you know, stakeholder engagement with law is important. So trade unions and employers associations are very key in how much there is awareness in relation to legislation in different countries and whether that will be translated into practice. So in 2004 in Europe, we had what is called the Framework Agreement on Workplace Stress, where employers and trade unions at the European level agreed that workplace stress is a very significant problem and they need to be working together to tackle it. And they did the same in 2007 in relation to harassment and violence at work. Of course, we also have national initiatives. For example, in the UK, we have what is called the Management Standards Approach for Work-Related Stress, which is a softer kind of approach, whereby the government has provided free tools and it provides benchmarks for the better companies versus companies that are not doing so well in this area, so that they can engage them and encourage them to implement appropriate good practice. That approach, interestingly, has been adopted in Italy recently, which some of us had thought that it would be a challenge, because the culture in different countries, of course, will affect the outcome. But so far it has been shown to work very, very well. Then there have been also a number of different other initiatives at the policy level, and recently there has been a standard in the UK, which actually came out before the Canadian standard. We have worked on the development of these standards, and when we were doing that, our Canadian colleagues had visited us in the UK, and we had interacted with each other and advanced each other on both the standards development. That came out in 2011, and of course the new Canadian standard on psychological health and safety in the workplace came out in 2013. So at the moment we're at the stage whereby we are doing pilot studies in both countries to see whether that is a promising area of standardization for the future. Finally, we also see that there are a lot of initiatives when it comes to inspecting workplaces. So we have a committee in Europe that's called the Senior Labour Inspectors Committee, and they've done a campaign on psychosocial risks. And I can also direct you to that. They have a lot of wonderful tools that can be adapted in every country around the world, of course, according to the national law, etc., policies. And they have been very useful to raise awareness in relation to these issues. But moving on to the organizational level, of course, The literature talks about different levels of intervention, and I really like this quote here because very, very simply it tells us what each type of intervention is and when different types of actions are appropriate. So Randall and Nielsen have said that if we know that factor A work characteristic, or a working condition, is linked to employee health, and the evidence is good, we might want to intervene to ensure that this factor is well managed. So basically, we deal with the source of the problem. That is called a primary level intervention. If for some reason we are not able to do this, we might want to look at how to protect employees against the effects of factor A, and that is called a secondary intervention. If we know that we cannot achieve either of the above, then we might want to look and see how the damage that has been caused by that factor can be repaired, and that is a tertiary intervention. And if we look in more detail, the primary level or work-related interventions essentially have to deal with stress reduction or managing psychosocial factors so that they don't affect employee health and the health of the organization. And we look at things such as redesigning tasks or participative management or career development or teamwork, etc. And to do that appropriately, we will need to always do a risk assessment to see which are the major issues that an organization faces before we decide on where to prioritize action. Secondary level refers to the interface between the person and work. And here we're looking at the response. So a lot of the stress management training that is done in organizations that is focusing on coping. So we have things like cognitive behavioral training or CBT, as you can see on the slide, relaxation training and different health promotion and lifestyle modification programs. So these are quite popular in organizations, and these are at the secondary level interventions. And finally, when we're doing with the effects, so people already have been negatively affected, we try to provide counseling or assistance both to them and their families, and usually we have a lot of employee assistance programs in different organizations, and these are called tertiary level interventions, and they are aiming at rehabilitation and return to work. And you can see that in many countries around the world we now see a shift towards rehabilitation because of sickness absence. And we know that sickness absence, of course, is a major problem, but the question is whether enough is being done to modify the work environment at the same time as helping employees so that they can be reintegrated effectively, and we can make sure that the problems that led them outside of the workforce in the first place will not be repeated. So what do employers do? Well, most employers are here. They deal with the problems after the problems have been expressed. So the usual issues in the workplace, absenteeism, presenteeism as well, when people are not well but they're attending work, accidents or near misses. More and more companies are now dealing with employee behaviors, so initiatives that relate to health and wellness, health promotion in the workplace, we find here. However, unfortunately, still we see very few initiatives that have to do with work design, work organization and management, dealing with the sources of the problems. And to be quite honest, if we really wanted to be innovative in this area, and as in all areas, we should be able to do a bit of forecasting to expect the problems before actually they represent a reality in the workplace. And we're really very, very bad at that, despite the fact that we have good data to tell us how we can intervene, both at the macro level and also at the organizational level. Now, I said previously that in Europe we have lovely policies, but to do the work in practice, there was a lovely employer survey with about 30,000 companies, and we talked to their managers. And we asked them also about psychosocial risks. And surprise, surprise, only 50%, I think this is also an exaggerated percentage of companies told us that they inform employees of psychosocial risks or implement appropriate interventions. Of course, you have to take these results with a grain of salt because it is an interview through the telephone with managers of companies. Of those 50%, 44% said that they had used information or external sources like consultants, etc., to deal with psychosocial risks. But Of these, we see that a lot of them report that they need additional information and support in 3 key areas: how to conduct risk assessments, how to design and implement preventive measures, and how to deal with cases of harassment, of stress, or violence. And these are reported across all countries and all enterprise sizes in all sectors, so there is no variance in these results, which means that we have still a long way to go. Now, I'd like to finish with reference to some good practice frameworks. There is a framework that provides a lot of nice information and facts that you might find interesting, as well as an online platform that you can go and look at. It's freely available, and perhaps you can modify it and use it for your own organizations. It's called PRIMA-EF, and that stands for Psychosocial Risk Management Excellence Framework. And that is the project that a lot of these organizations that I showed you in the beginning had to work together. And there were a lot of advisory organizations. Not all the acronyms at the bottom basically have to do with agencies of the European Commission, with associations of experts, as well as employers and trade unions across Europe, because as I said before, they very much prioritized these issues. So this project focused a lot on the concept of risk management, but also tried to raise awareness about how it can be incorporated into what we call strategic risk management in the organization. And I think we have a long way to go, because we see that still there is a lot of resistance in the business world and in business schools to educate managers effectively and appropriately about these types of issues. It also tried to raise awareness about the different network of stakeholders that we should be considering when we're discussing these issues. And they include also employees and society at large, and not only shareholders, which is what unfortunately our leaders often only think about. So you can see a model here, and there was an equivalent model that was developed for the country level. And you can see that here we see that we have to consider management and organizational work processes. So the process of managing psychosocial risk has to be embedded in the management organization of work, in operations of the company. It has to be a cyclical process that leads to organizational learning. So evaluation is a very key component of the whole process. And if you look at on the right-hand side, you see that we should not only be thinking about outcomes such as workers' health and safety, but also business-related outcomes, productivity, quality, innovation, and societal outcomes at large. And all these, of course, are interlinked, and there are examples and case studies that it has been shown. It has been shown that it's possible to do that, both at the enterprise level, but also, as I said, there's an equivalent model for the country level. This presentation will become available, so we will have this link at the bottom, prima-ef.org, and there you will find a lot of useful information. As I said, this is a guide we have developed for the World Health Organization, and there are also fact sheets, and also there is some e-training. So I just included a snapshot of e-training, and if you log on to that, there are different modules, as they're called, on the key concepts: what are psychosocial risks, what is workplace stress, but also there are more specific modules with advice for managers, advice for employee representatives, for employees themselves or professionals in this area, and it is freely available, as I said, and organizations have the opportunity to log on and to request to have rights as a coordinator, and then they can adapt it in collaboration with us and use it. And it's a very flexible platform that we use, Moodle, that I think a lot of people know. It's very, very flexible, and you can use it according to your needs. Also, all the information that I mentioned before, and that includes a lot of the best practice, is being found on the platform, and also supports the implementation of the 2 standards that we now have. So it's relevant both to the implementation of this standard, which is the British standard that we talked about before, but also the Canadian standard. I don't think that if you compare those 2 standards, you will see any difference in the key principles and the key messages. and they both complement existing health and safety management system. I don't know whether many of you know, for example, the system called OSHAS that is widely used in many countries. So if a company already uses a health and safety management system, they could very easily implement these further standards into their business operations. That was the idea. Finally, I would like to show you this model. This model has been developed by the World Health Organization, and it's called the Healthy Workplace Model. And in this model, you can see that the WHO is trying to show that ideally we should not be thinking about the psychosocial work environment in isolation or the physical work environment in isolation. To create a healthy workplace, we need to consider different aspects. Personal health resources, for example, on the right stands for issues that relate to health promotion in the workplace. Enterprise community involvement has to do with activities of the enterprise in its local community. And also here a concept that you probably have heard and is relevant is corporate social responsibility. So they have tried to come up with a sort of a comprehensive model that is based on, again, a cyclical, continuous improvement process, and they have highlighted at the core of this model ethics and values are very important, leadership, engagement, and worker involvement. And what we're doing at the moment, because we are working with the World Health Organization as a collaborating center, is to develop an audit tool for the healthy workplace model. We have a draft at the moment. We have two versions, one for small enterprises and one for large-scale enterprises. And what we've done is we've developed a number of indicators. So if a company wants to implement good practice according to this WHO healthy workplace model, how can they do that? And what are the key things that they need to be thinking about and to implement? So this will become available soon. We will soon be starting a pilot. So if you would like to be involved, my email will be at the end of this presentation, and we'll be happy to share it with you around the summer. So I'd like to finish with the key messages before we go to the question and answer session. So obviously, I think that it is very clear that psychosocial risks underpin any business activity. So I don't think they're going anywhere, they're here to stay. Also, we know that all organizations, with no exception, engage in what they call enterprise risk management in different areas of business activity, whether it is strategy, whether, most importantly for them, usually it is economics, financial activity. However, they consider much less issues that relate to the psychosocial work environment, all as they have emerged in the business leadership what they call people risk. So we think that we need a shift in culture towards recognizing the opportunities that managing these types of risk can offer, both for individuals and organizations as well as society overall. We need to be thinking about the process as a powerful, dynamic process, a positive tool, despite the fact that we're talking about risk and we might be used to thinking about only negative outcomes, a positive tool that can achieve organizational outcomes and essentially in the end develop healthy workplaces and healthy societies. So thank you very much for your attention, and you can find here also my email and some links to the websites that I have referred to. Thank you.
Great. Thank you very much, Dr. Leka. That was a really great presentation. Very informative. I do have a couple of questions.
Sure.
One is someone was referencing the graphic that you showed about factors and how they're affected once people retire from places that have work stress. And someone said that in the graphic, you have fatigue as an independent item from depression. And they're wondering that if that would mean that they should address fatigue as an independent condition, not just a symptom of depression.
Yeah, okay, that is a good question. Thank you for the question. Yes, this is, I think this research thing comes from Germany, and you're right, of course, they're not completely independent. Of course, they're very, very much dependent. I'm guessing that it had to do with the design of the questionnaire, and also that these researchers wanted to show the different symptoms, if you like, or the different health conditions on which they had questions in that questionnaire independently, just to strengthen their case. So this is what the paper I have referred to has shown. And this study comes from Germany, but you can find it yourselves and look it up.
Great. And then someone else was asking, when you were referencing the European Union stats about how much it affects the GDP, they were wondering if you had a percentage about workers that are affected by stress that was associated with that.
Yeah. Well, it varies, obviously. I mean, in the European Union, as I said, I think I had it somewhere, that 1 in 4 workers is affected by work-related stress. And in some countries, of course, this is a higher percentage. So it varies between around 25 and 40%.
Very good. And then that's all the questions I have. Let me just give it another couple of minutes. Anyone online, if you have questions, feel free to type them into the questions box, and we'll get them answered by Dr. Leka. Someone just asked, is there any literature relating to competency of management related to psychosocial risk factors?
Yes, I think that's a very, very good and relevant question, and also something that we are struggling with at the moment, because of course we have a couple of standards out now, but to implement the standards effectively, you need to have competent people on the ground, and also competent managers. There's not a lot of literature on that. I can direct you to the Health and Safety Executive in the UK. So if you Google the Health and Safety Executive and just Health and Safety Executive and stress, you will be taken to the website, and there you will find a very nice tool that is called the Line Manager Competency Tool for Work-Related Stress. So they have even developed the tool, and they have a couple of reports, and you can, I think that will be useful for you.
Very good. And then someone else asked, are there exemplary companies who appear to be doing this well with demonstrated business outcomes?
Yeah. There are. In the UK, again on the same website actually, keep referring you to that. In the UK obviously because I know best, because I'm based here. They have what they call business case studies. So you can read about actual case studies, and you can also hear about managers and what they tell you they have done in the different companies. In the literature you can find also other examples. On the top of my head, there is a very nice company, for example, in the oil and gas sector in Norway, that has done fantastic work in this area. And they have started even publishing scientific papers on this. So please email me if you like, and I can direct you to this paper so you can read about it yourselves.
Very good. I was wondering actually, as well as Dr. White is on the line too, our executive director, we're wondering if you would be able to maybe just make a list of resources, just a basic list of resources, and then we can post those on our website for everybody to
yes, that's no problem, but I would like to know whether you would like, I mean, because there's so many resources, is it just a mix of things that relate to policy, to practice, scientific evidence, or just a bit of everything?
I think the scientific evidence would be helpful, and tools and toolkits. So like you were referencing some of the business case studies, those types of things that are practical items people can use.
Okay, no problem. Sure.
That would be very helpful.
Okay.
Great. I think that's everything. I don't have any further questions. Oh wait, actually I did just get one.
Okay. Yeah,
do you have any advice for an employee that sees and experiences work-related stress but works for a boss that's not aware of his role of causing and managing this stress?
Well, that's a difficult one because, yes, I think if you're not aware of what is causing you stress, and of course there's a lot of stigma associated with this area, so people, even if they are aware, they're less likely to disclose. So awareness is very, very, very important. In that case, I would think that probably if the employee does not feel that they can raise the issue with a manager and they talk it through, Actually, those case studies that I refer to on the Health and Safety Executive website, you can also find employees that had this problem. They're talking about their experience and how they followed up. We also have advice for employees on the platform that I talked about, that you can read about. But if we don't think it's possible for any solution to be found in the workplace, of course we turn to solutions that are more individual based. So we try to see things with a more positive perspective so that you avoid the negative outcome. I would of course never promote just this kind of practice in the workplace, only because, as I've said before, it does not deal with the sources of the problem, but only the symptoms and the outcomes. But individual level actions can also be very helpful in cases where very little can be done at the organizational level.
Very good. I think that is all then. I think we'll go ahead and end the session. Thank you everyone for being here today, and thank you Dr. Leka for your presentation. It was very great.
My pleasure.